Well, ballots pointed out major metropolitan areas like Memphis, Nashville, and Knoxville only have one level 1 trauma center.
Jackie DeFusco traveled to Knoxville to find out how their system works. She joins us live from Ballots COPA review hearing.
Well, Josh, Sarah, this COPA review meeting has been underway for about an hour now, and we've already heard a number of people speak, and it's clear that access to care remains central to community concerns, certainly when it comes to Ballot Health's plan to consolidate level 1 trauma services in Johnson City. And that's why I traveled to Knoxville ahead of this meeting to get a sense of how that region operates with only one level 1 trauma center and a largely rural region. Knoxville's UT Medical Center has been home to the region's only level 1 trauma center since the state first started designating levels in the late 1980s.
At that time, patients were taken to the nearest hospital, and hospitals weren't always prepared to take care of severely injured patients.
These trauma experts contend that it was the regionalization rather than duplication of higher level care that improved the region's injury response.
And the idea is to get the patient to the place as quickly as possible where they can get the care that they need. And that's why regionalization becomes important, because also these resources are very expensive and you don't necessarily want to have every hospital paying for those resources.
It's the problem that when you're duplicating efforts, it's hard to get that many surgeons and consulting physicians into one building, and to have two of them in one area is really hard because recruitment alone.
Trauma surgeons don't grow on trees.
But even with that change, they say certain challenges remain for their regional system.
If you look at trauma care across the country, patients who are injured in rural areas have a much higher risk of dying from their injuries than in an urban area, simply because it takes longer to find them, extract them, and then get them to definitive care.
That's why many are concerned with Ballot Health's plan to consolidate level 1 trauma services at Johnson City Medical Center, a location critics contend is not centralized.
I think it's helpful to be centralized. Time is of essence in trauma, there's no doubt about that. But I think there are ways, when you truly regionalize the system, to mitigate some of those things.
They say their rural EMS teams are sometimes diverted for long periods if they're forced to make the trek for level 1 trauma care. That's why they've strategically placed 5 helicopters across the region.
They're key for rural transports because, even though patients may not be far away by helicopter, coming through some of these mountainous roads can take a long time.
They also have a centralized call system and emphasize decisive communication is key.
For concerns in a rural area like that, I would think that the medical directors for those ambulance services would need to maybe get together with the trauma centers that are available and work that out, what would be the most appropriate thing, and maybe they need to look at, changing some of their destination guidelines.
But they say being an effective trauma center isn't just about response following an injury.
Starts from the event, and it starts with prevention, it starts with EMS, and it goes all the way through rehabilitation.
Ballot says neither of the Tri-Cities level 1 trauma centers is doing as much prevention as they should be. UT Medical Center kicked up efforts about 4 years ago, and they say they're already seeing results.
We have actually had several patient incidences in the last couple of years that we know that their life was saved because of someone that was at the scene that knew how to stop bleeding.
Now, the state has actually already authorized Ballot Health's plan to consolidate level 1 trauma care, and it's unclear whether the widespread opposition from local leaders and a lot of people here tonight, Ballot Health hasn't shown any sign of backing off of that plan. Live in Bloomfield, Jackie DeFusco, News Channel 11 in your corner.